We are incredibly thrilled to have you join us. And, this session is, in my mind, incredibly important. Speaking of minds, I don't know about everybody else, but I don't consider myself a nervous or anxious person, but I think we've all probably run the gamut of emotions over the last 8 weeks. And I have a feeling there's still more to come. So this seemed like a really great time to gather everyone together. And I think the point we really wanted to get across with this session is you're not alone, right? The things that you're feeling and the things that you're thinking are things that are being expressed and shared all over the world, outside of our community as well as inside. So we wanted to put this session together to say thank you to everyone, but let's all get together, let's have a chat, and hopefully be able to share tips and learn from each other. We have a really great program. Dr. Daphne Holt is going to share with us the program that she's put together for first responders at Mass General Hospital. And I personally got a chance to watch the videos for this program. And I know it really helped me in understanding some of the things that are happening around us, but just giving ourselves just a minute, right? To say, it's okay that I'm not okay. There's kids, there's family, there's work, there's everything else around us, but it's really okay to just take a minute to recognize where you're at and work towards a center again. And just a real quick sponsor shout out. We couldn't do what we do without our sponsors. So Sunrise Labs, the Mullings Group, Zymedica, thank you for supporting our Women in Medtech events. We are hoping to get together in person again soon to highlight the work that you do. But thank you for all of this. So I think this is a great time to introduce Dr. Daphne Holt. I've told you a little bit about the program, and she's going to tell you a little bit more, but I was incredibly impressed by the program that she and her colleagues at MGH put together for frontline workers. And it just reminded me so much that each one of us is our own type of frontline worker, right? A lot of people are dealing with so many different stressors. We say, let's all get back to work, but let's keep it real. So many women and men are now working 3 to 4 jobs, right? You're working, you're teaching, you're guiding your families, you're dealing with a whole lot of outside pressures and stressors. So I think this is just a really great time to come back to that. So Dr. Daphne Holt, please take the lead. I will stop sharing my screen.
All right. Well, yeah, thank you so much for inviting me. It's really great to be at this meeting. And yeah, thanks, Rachel, for inviting me. And it's wonderful what you all are doing. I really am impressed, and good to know what you guys are doing to contribute to this, to helping people during this crisis. So yeah, as Rachel mentioned, let's see, I'm going to share my screen, I guess. Yeah, I'm going to talk to you a little bit about some of the work that my group has been doing. And as Rachel mentioned, we developed this course for frontline healthcare workers. It's an online course that anyone can watch. So you can go to our website and watch it. And what I'm going to talk about today is basically taken from that course. But, essentially it's, what Maria already kind of started to talk about, some of the things that we can do to help improve or sort of increase our resilience during this time. And, as you all were just saying, the idea is not that like we'll use these tools and all of a sudden we'll be fine. Of course, it's perfectly normal and expected that we would not be okay during this time. But the idea is that our ability to manage stress is something that we do have a little bit of control over. There's some things that we don't have control over that determine how we handle stress. But there is some parts of our, we do have some capacity to change our ability to be resilient. So I'm just going to talk a little bit about what resilience is, and then some of the tools that people have studied and shown that actually can increase resilience. So what is resilience? It's a word that is kind of thrown around a lot, it's defined in different ways, and researchers define it in a certain way, but essentially what it means is it's the ability that someone has to kind of handle very stressful situations like the situation we're in right now. the ability to kind of bounce back and adapt and sometimes even grow during really difficult situations or crises. Um, and as I was just saying, it's not a fixed trait. Sometimes people think that either kind of a resilient person or you're not. And there is some component of resilience that is genetically determined. People are still doing research to determine sort of the amount of that. But there's also a lot of our resilience that can change and is dependent on different sort of factors in our lives. So some of the things that people have shown predict resilience or sort of, are correlated with the ability to handle stress are things like, things that you would guess, right? Like strong social connections, also physical activity, a sense of purpose or meaning in life is correlated with resilience. People who have spiritual practices or religious practices um, have more resilience sometimes, and certainly community supports. Some of these things we can control and some things we can't, obviously. But there's also these kinds of skills or sort of mental capacities, ways of experiencing the world, the physical world around us, like Maria was talking about, mindfulness, and the ways of experiencing ourselves that actually can promote more resilience if we practice them. So just to throw in there, because I know you guys, a lot of you are scientists or inclined in that way, these are techniques or tools that have been shown through research to make people more resilient. And you can operationalize the concept of resilience as the response to a stressor. So these are sort of evidence-based methods that have been shown through lots of studies to be helpful to people during times of extreme stress. But one thing that's really important, but sort of the first thing I want to sort of emphasize, is that everyone is different. What helps you feel resilient or handle stress is different from your partners or your neighbor or your coworker. There's no sort of simple formula for everyone. So I think one of the first things I would say that's really important in thinking about this topic is just to think hard, just yourself. I mean, we could take a minute right now or after this to think about what in your life has helped you be resilient in the past, and what is it that you could perhaps do now that you have done in the past that could help you feel more grounded. And obviously there are many things that people do in their normal life that we actually can't do right now. We can't go to the gym, we can't go out and see our friends as easily, and all of that. But I think, if you think hard, it's sort of like one of these things. You can have a kind of problem solving approach to it. What are some of these things that I used to do that help me feel good or kind of more stable in sort of myself, that I can still do now, or I can do a form of it now. I can do a form of exercise, or I can connect with people via FaceTime or Zoom or whatever. And, there's some things, I think people have sort of noted that there's some, some people are sort of enjoying some aspects of the quarantine, and that, our lives are kind of slowing down in some ways. I mean, some people's aren't, obviously, at all. But for some people, there's more time to spend with one's children, not always positive, but sometimes. That there is a little bit more of an opportunity in a way to kind of be mindful in the way that Maria was talking about. So I won't go into this too much because we just talked about it, but mindfulness is one of these words, again, like resilience, that's kind of thrown around a lot. And I think sometimes people think they know what it is, and they may or may not be correct. Some people think that mindfulness is just kind of relaxing, or or that it's this very formal practice that nobody could possibly have time for. But really, mindfulness is just something very simple. And John Kabat-Zinn is kind of a leader in this area, somebody who's written a lot of really great books about mindfulness. It really simply is paying attention in a certain way, paying attention in a sort of non-judgmental way to the present moment. So, the idea is that in reality, all we have is the present moment. It's just like the past is gone, the future hasn't happened yet. So our lives are in the present moment. Um, so, and there are lots and lots of ways to be mindful. You don't have to sit in the lotus position and do a formal practice. You can just take a moment and notice the world around you a little bit more, or how you're feeling in your body. And so just a little is better than nothing is the way I think about it. And just kind of reminding yourself a little bit of time each hour or each day to pay a little bit more attention is a great start. And then again, because I think you guys are interested in this sort of evidence, there is abundant evidence that mindfulness, even though it seems so simple, like how could it make that much of a difference, it actually is very good for your mental health. And people have done studies of the brain to show that it actually changes the brain. So for example, this one study here that's on this slide shows that people who are meditators, pretty serious meditators, show brains that actually look younger, and that they have more brain volume. Their brains have aged less than people of the same age who don't meditate. And there are lots of other studies that suggest that mindfulness is actually quite good for your brain, and thus also your mental health. I'll wait for it to finish.
Hey, Daphne, if I could jump in real quick, I just wanted to
Yeah.
highlight two things you just said that I thought were really important. And, the first about being in the moment, because all we have is the present. I think that is a really good thing to keep in mind. I think so many times I get caught up in, well, this is how it was before, and what is it going to be like moving forward? I think you're absolutely right that right now, this is where we are, and it's good to understand how that affects you. And then the other thing, it is kind of the follow up to that. It's that problem solving thing that you just talked about. It's, what am I unhappy with? I think, what is the perfect solution, and what is the step that I can take now to make things better? And I think those two things are really resonating with me personally. I don't know about anybody else, but I wanted to highlight those two things because I think they're really important.
Great, thanks. That is so helpful. So I was just going to play I think it's like 1 or 2 minutes long, an exercise from this course. It's a little bit similar to what Maria just went through with us, but this is a similar kind of mindfulness exercise that you could, possibly do during your day. And
here's a brief mindfulness exercise that we can try, and you can do almost anytime, anywhere. Right now, let's invite ourselves to take a pause. If you can, you might sit in a comfortable position. If you're able, close your eyes or adopt a soft gaze. And bring your attention to your breath. How are you experiencing your breath in this moment? You might place one hand on your chest and one on your belly, and simply feel your breathing. Notice how your belly rises as you breathe in and falls as you breathe out. You can imagine your lungs filling up like 2 upside-down balloons, the biggest expansion at the bottom. When your mind starts to wander, just bring yourself back to focusing on your breath. If it helps to create a focus, you might try counting your breaths. Stay here for a minute or more, And if you can, allow your body to let go just a little with each breath. When you're ready, you can open your eyes and let go of this brief practice. This is also something that you can try if you're a parent or caregiver with your child. You can sit or lay with your child, and you or they can put their hand or your hand on their chest and their belly, allowing them to also feel the rise and fall of their breath and come to a more calm, centered place.
So I think I've already also mentioned these points, but just the idea that mindfulness doesn't need to be a certain way. You don't have to sit a certain way. You can do it while you're eating, while you're driving, while you're brushing your teeth. Actually, washing your hands is a great time to be mindful, because we all have to do it so much now. And just feeling the water on your hands, thinking, being aware of some of the thoughts that you're having, that maybe about the pandemic, or about the situation, and bringing yourself back to just washing your hands. I think it's a good opportunity. So one thing you may have noticed during that exercise, or other times, is that you may have become a little bit more aware of the thoughts that you're having, which is one of the sort of the goals of mindfulness is to have that greater awareness of your thoughts. And some of the thoughts might have been kind of anxiety provoking, like, oh, I don't want to do this, or I've got so much stuff to do. I have so many emails to answer. I gotta go, that kind of thing. And those kinds of anxiety provoking thoughts, are probably going to be associated with some feelings in your body, sort of tightening of your chest or your jaw. And so this relationship between thoughts and feelings is sort of the basis of a very long-standing model of how the brain works. And it's very normal to have this kind of this circuit of thoughts leading to feelings, and then the feelings sometimes produce more thoughts. And sometimes there can be kind of this cycle of negative thoughts and feelings that can get a little bit out of hand. So one of the points of mindfulness and of like becoming more aware of your thoughts is to try and interrupt this cycle a little bit. And another part of the cycle is that sometimes these thoughts and feelings can lead you to doing certain things that actually can make the thoughts and feelings get worse, like you get angry at yourself or at someone else, or you withdraw from people because of the thoughts and feelings, and that can actually sort of worsen the cycle. So the idea is, if you become more aware of this cycle, you can actually notice that some of these thoughts are not actually accurate or helpful, and it can help sort of interrupt this cycle. So one thing that is sort of is a big deal right now, I think, for everyone, is just the incredible uncertainty that we're all kind of dealing with, that we really just don't know what's going to happen here, and uncertainty is a really challenging thing for the mind to deal with. Our brains do not like uncertainty. We really want to just know. And in fact, we would rather like think something bad is going to happen, or just conclude that there's going to be some sort of catastrophic event sometimes, than just not know. I mean, it's a funny kind of quirk of our brains that that's something that happens. And so there are different kinds of ways that people interpret the world, in order to come to some conclusion that can, in the end is sort of counterproductive in terms of our resilience. So, jumping to conclusions, thinking we know what's going to happen, and it's going to be terrible. Catastrophizing is similar. Black and white thinking is when you think you kind of go between, it's going to be all good or all bad. Mind reading is kind of when you think that you know what somebody else is thinking or what somebody else has intended, even though there might be a whole range of possibilities that you haven't considered. So a lot of the point of mindfulness and also being aware of this cycle of thoughts and feelings that can happen, and that our thoughts are really not facts. The goal is to try to think more flexibly and kind of loosen up the conclusions and consider a range of possibilities when you're thinking about what's happening in your life, and the motives of other people. So one really important barrier to flexible thinking is the fact that when we're under a lot of stress, this thing happens in our bodies that people call the fight or flight response. It's when you have adrenaline released, and it's kind of an adaptive thing to happen in animals when you're in danger. Is all these systems get activated that help you defend yourself from threats. Your heart starts beating faster, you start breathing faster, your pupils dilate so that you can kind of see better, you take in more light, your muscles are ready to sort of act. But the reality is, in our normal kind of 21st century lives, having this big response is not very helpful for being able to think flexibly and for being able to consider a range of possibilities, and to avoid sort of jumping to conclusions in that way, and to avoid the distress that comes from all those sort of conclusions that we kind of come to when we're kind of stressed. So one thing that's really important when you feel like you're in the fight or flight response, when you're in a state of elevated arousal, is to just see that, to acknowledge that, notice it, and try to do something to bring that arousal level down before you conclude anything, before you act on those feelings. Because I think everyone right now is really not at their best. That's how I like to think about it. People are under stress in a way that is just unprecedented in our lifetimes, and so I think taking a breather when there's conflict, or when there are things going on that you don't understand, before you act or say something or draw any conclusions, I think is like a simple rule of thumb that I have been talking about and applying to my own life. So the last thing I'll talk about, the last sort of tool that we have been sort of emphasizing, is this tool called self-compassion, which, like mindfulness, comes from Eastern practice. It's sort of originated in Eastern religions. But it's been really popularized in this country by two researchers and clinicians, Kristen Neff and Chris Germer. They have this program called the Mindful Self-Compassion Program, and they have a website. I encourage you to look at it. They have lots of great things going on. And I think self-compassion is particularly good for people who are, kind of strivers, like I'm imagining all of you are, people who really want to do their best and tend to be kind of hard on themselves when they make a mistake. And, I know lots of people like that. And, it turns out that being hard on yourself and self-critical actually doesn't help people to perform better. And it causes a lot of distress. So self-compassion practice, I think, is really useful for people who tend to be hard on themselves. And the fundamental idea, it's very simple. It's basically a practice where you learn to be a good friend to yourself. So you think about, what would I say to myself if a friend of mine was in the same situation? Because if you actually do this exercise, we won't do this right now, but if you do the exercise where you imagine a friend being in the same situation as you are and what you would say to them, people often find that it's very different from what they say to themselves when they've made a mistake. It's amazing how much harder we are on ourselves than we are on other people. So the idea is that we want to try to figure out how to become an inner ally rather than an inner enemy, as Kristen Neff and Chris Germer put it. And again, I'll just show you very briefly, there's lots of evidence that self-compassion practice improves mental health and resilience. I think it's very clear from the studies that have been done. But, you know, a lot of people are uncomfortable with this practice. You know, people feel like it's self-indulgent or it will make them weak or lazy, you know, and that actually self-criticism is what actually drives them. Um, and, you know, I'm not going to be able to talk you out of that if that's what you're thinking right this second. But I would just, you know, say you might want to just experiment with it. You know, you might want to just see if this is actually true. If you let go of self-criticism, does it actually make you work less hard? Because the studies have shown that it's not actually true. That if you let go of self-criticism, you actually have more energy because you're not dedicating so much energy to this sort of beating yourself up. But we can talk more about that if you like. So here is another exercise which is called the self-compassion break. It's an exercise that was developed by Chris Germer and Kristen Neff. And so I think this is another thing that people can do anytime during the day to help remind them of, you know, being kind to oneself.
Let's try an exercise together to see what relating to ourselves with compassion might look like in practice. This exercise has been adapted from Drs. Kristen Neff and Chris Germer's Mindful Self-Compassion Workbook, and it's called a self-compassion break. First, let's take a pause. And during these next few moments, all you are doing is this exercise. There are no other demands on your attention. Bring to mind a situation in your life. Could be about the current pandemic or something else that is causing you some stress. What are the thoughts that are present around this situation? What are the feelings you're experiencing? How is it showing up in your body? See if you can turn towards it and allow the discomfort or whatever is here to be here without pushing it away or feeding it. You might try labeling what's going on with something that fits your particular situation. You might say, this is stress, or things are really hard right now. We are bringing our mindful awareness to observe and label the situation we are in, not judging it as good or bad. Now I'd invite you to say to yourself, I'm not alone in this. We're bringing our awareness to the fact that we are connected and not alone in the struggle during this time. You can use any language here that's right for you to convey this sense that we are in a shared human experience. And now I'd invite you to say to yourself, may I be kind to myself. You might ask yourself what you need to hear in this particular situation to relate to yourself with kindness. It could be, may I be patient? May I be brave? May I accept myself as I am? Whatever speaks to you in your particular situation. Sometimes it helps to put a hand on your chest or adopt a soothing touch that feels right for you. Something that cues us into the fact that we are in need of kindness and compassion during this time. If you are finding it difficult to think about what a compassionate response might be, you might think about what a good friend or a loved one might say to you in this situation. What might they do? Really call to mind how it feels to hear these words, to think about what it feels like to have a good friend or loved one say these things to you. As we close, again, bring your attention to your body and your awareness of what is right now. Again, taking that pause to check in before letting go of this practice, knowing that you can return to it at any time.
now I'm just going to show you a very quick
The thing I've probably
clip.
been hardest
Well, you'll see.
on myself lately is not being a present parent because I'm so stressed out. So when my kid wants to sit down and do Legos with me, and I'm irritated that she keeps saying mom because I'm trying to check the news on my phone, and then my mind will drift to what's going to happen to my family if something happens to me, that I can't even be present. So here I am worried about not having my family, but then when I'm with my family, I can't enjoy them because I'm so nervous about what's going on. So being hard on myself and not being able to just appreciate what I have right now, that's difficult for me. And I absolutely know that a good friend or even God would be like, you're doing the best you can, you know? These are really hard times and you're doing the best you can.
So yeah, that was a clip of sort of self-compassion in practice that I wanted to show you. And so I think that, we can all think of examples in our own lives where we're hard on ourselves, where maybe we could apply a little bit of that, especially right now when it's just so hard, with juggling everything that we're juggling. I don't know how many of you are trying to homeschool your children, while you're trying to maintain your job. Some of us have lost our jobs. Some of us are worried about our health, or the health of loved ones, or, what's going to happen to the world. So, I think this is a really good time to use that particular tool that, it's really hard to be perfect right now or even close. So I'm just going to summarize. This is my last slide. It's the things that we've talked about, and then, perhaps we'll have a little bit of time for questions or discussion. I hope so. So, some of the tools that I've talked about, sort of the most basic thing, which might actually be in some ways the most important, just thinking about yourself, what has helped you in the past. Some people need alone time to feel, grounded. Some people need to be with other people and connect. Some people need to be in nature. Everybody is different. I think just kind of really making a conscious sort of effort to think about this is an easy step to take, I think. Mindfulness, we talked about that, staying in the present moment, just one foot in front of the other, one day at a time, I think is really a useful way to think about how we can live our lives right now, that we don't need to focus so much on trying to predict the future, because no one really can. And then the idea that we need to be flexible and try to be sort of generous and suspend judgment, I guess, when we think about what's going on with other people and what's going on when we sort of encounter stressful situations, that we can't always know immediately what's going on. This is a completely bizarre, unprecedented situation, as we hear over and over again. And so uncertainty, unfortunately, is with us, and that we need to learn to some extent how to deal with it, how to live with it. And then, self-compassion, which I think is particularly appropriate right now, that we can all take a little bit of a moment to acknowledge that things are really hard and that we can't do what we used to be able to do. And that's just got to be okay, well, and that we're not alone, and that we're all in the same situation, So I think that is it. So, a lot of what I talked about, as Rachel said, are pieces of this course that we developed for frontline healthcare workers. And it's also something that we've been doing for the last 3 or 4 years in colleges, in the local Boston area colleges. That's sort of where this all came from. And I want to give a little bit of a shout out to my amazing colleague, Nicole DeTore, who played a huge role in developing the materials for the videos, and also Annie Burke, who was in all of the exercises, who's our sort of director of intervention development. So thanks so much for listening, and look forward to questions or comments.
Thank you so much. That was really great. I know it brought up a few things for me, right? And I think, if I'm being honest, when I tend to get when I tend to get stressed out, or when I tend to get a little anxious, it's not something I want to share with others. And I found that sharing it makes it so much better and a little bit easier, and that a lot of people will have so much more compassion for you than you have for yourself. So I think that was a really great point to bring up. We struggle with getting into a daily practice with mindfulness. Any ideas on how to make that a routine? Is it, something you should do at the same time every day? How do you kind of remember? I often forget, right? How can you remember to kind of squeeze that in?
Yeah, no, I think that's a really good question. And I have to be honest, I do not have a formal mindfulness practice. My personality is such that if I have to sit and do nothing, I become more anxious. So I think of mindfulness for me is, I think having certain routines that remind you of it. Like, for example, every time you brush your teeth, if you could just feel the toothbrush on your gums. I have a routine right now where I take a walk to the Charles River every day, and I just have a very simple one word kind of resilience cue: water. I feel that if I see water, it boosts my resilience. And that may be actually completely wrong, but it's a little trick that gets me to do this walk. And so I think actually breaking it down to make it incredibly simple to remember is really the first step. And if you have the ability to have a more formal practice, I think sometimes people get started and they see the benefit, and then it's like anything. It's like when you see that it's great, then you want to do more, and then you figure out a way to incorporate it. But for me, I have a child, I have a job, I have all these things. It's hard to have time to spend an hour meditating. So I think, as I said, anything is better than nothing. And you'll be amazed, I think, that you may not feel like immediately like peaceful and centered and calm. That's not the idea, but you may see some benefits pretty quickly.
We had another question about kind of helping manage teenage kids and their stress. Any thoughts on that?
Yeah, no, that's a big one. I think I think that there are no easy answers to the parenting question. I guess, a few things that people have been saying that I've been saying is, one thing that you can, I mean, there are a few things you can do. Obviously, talking to your teenagers, being very honest with them about what's going on, being real with them, that we're all struggling, can maybe help. I think modeling some of the mindfulness and other kinds of kind of resilience promoting behaviors can sometimes be helpful. And, I think teenagers are funny in that they may not seem like they're taking anything in, but sometimes there's a delay, or it may go in and then come out like 3 days later or a week later or something, where they seem like they've responded. Yeah, I think modeling, being honest, but yeah, no, I think there are no easy answers with this situation that we're in that's sort of untenable. And I think so also just like really acknowledging that this is hard, and it's kind of impossible. And I think for teenagers too, it's to help them kind of acknowledge what they're feeling, rather than having them just act out what they're feeling.
Appreciate that. And Erin, just to respond to your question, I think a lot of us are creatures of habit, and normal is not going to be normal again, right? It's going to be a new normal probably for quite a while, and I think we're all trying to figure out what that looks like. I think what's helped me is trying to develop some habits for this normal, and try to get into a routine, knowing that may not be the same. But I think the anxiety is there for. I'd be shocked if most people aren't feeling it. It's, and that was actually kind of the point of what we wanted to do with our breakout sessions in this next 10 to 15 minutes. when everyone signed up, you identified a topic that you may want to talk in a small group about or share. We would really love to have you break out into smaller groups, and the goal is to kind of take what Dr. Holt just talked about and hopefully share in a small groups, maybe some tips, scenarios, situations. The idea is that, you know, you're not alone. And I think that's something that we've been talking about the entire session is you are not alone in this. You are not feeling things that no one else is feeling. So are there ways that we as a community can share the things that are working, the things that aren't, the struggles? I know I used it in my email blast, but I can't help but come back to it. You know, when you share a joy, it's doubled. When you share a trouble, it's halved. So share the good things, share where you might be hoping to help some tips. And please join me in saying thank you to Dr. Holt. I think this was an amazing session. And so thank you, Daphne.
Oh, you're welcome. Yeah.
So thank you everyone for coming. And I really hope to see you all next week.